Hold
So,
on.
if anyone's here, today we're going to be talking about the skincare regimens. And if you're on YouTube,
There we go.
there you go.
Hi, everyone.
Hello, everybody. Is anyone here though? 2 people.
Well, yeah, it's early. I mean, we're
Yeah,
waiting
it's early.
for people
Ow.
to come in. You help me. Help me out.
Okay, so
Just checking, folks, if we're live. If we are, please give us a shout out. Let us know that you're there.
yeah. We're gonna be talking about skincare regimens, and if you're on YouTube, please like, subscribe, click the notification bell.
There we go.
And
Okay.
you're distracting.
Am I?
Yeah. And if you're on Facebook, please follow us at VMV Hypoallergenics.
There you
Also,
go.
shop at
Hello, everyone. I'm Laura. I'm the CEO of VMV Hypoallergenics. That is
Gavin.
That's right. He is here for all of what, 10 minutes? 5 minutes?
Let's see. No, 11 minutes.
11 minutes. in
11 minutes
school.
and 13 seconds.
So we're starting the new year with our first Skin Sites live this year, and our topic is
Regimens.
regimens, skincare
Skincare
regimens. We rehearsed that. No, we didn't.
No,
Do you have a regimen?
Regimen.
How old are you?
10.
I'm just saying.
I'm making a point.
I'm just saying. I actually started my regimen at 9. Tita Cici started at 9, I think a little bit earlier. And your sister started at 9.
Mute. Kidding. I'm kidding.
Do you remember what products you even use, or you just grab what's there in front of you?
I grab what's in front of me. Usually I remember when I'm actually doing it, but when I'm not, I think about other things. For example, I have a class.
Indeed. Okay, so
right,
on that
let's go.
note, I will get started here and say welcome to our first Skin Sites live stream of the year. We took a break for the holidays,
Yeah.
but we are back. And,
We
you know,
are back
new
with a
year, which has started off a little interestingly, but nonetheless, new year, new hope, you know, new commitment to healthy habits and stuff. So, of course, that comes with skincare regimens.
Yes, it
Before
does.
sort of I delve into that a bit more, please remember to ask your questions early. The earlier I see the questions, the more chances I can make sure that my mom or I get to them, especially for VMV related questions. Ask them early when I'm on, because when my mom is on, we really focus on the more hardcore medical skin stuff and not so much on VMV products. So if you have a VMV related question, ask me early.
DM or PM if you have a question after the live, so we can prepare it for
Also,
you.
we can also answer. And don't forget to comment about any other topics that you'd like to learn about. We're populating some really interesting things, actually.
So we
But
can-
still, it'd be good to know what you would like to know.
Yeah.
And today, we're giving away a great addition to any regimen, which is the Re-Everything Eye Serum, which is one of our best sellers and very popular product. So
I like it.
to
It's fun to
qualify,
play with.
just make sure that you comment, that you follow us on Facebook, and that you comment and ask us a question.
You'll win
And
this.
at the end of the live, we will pick a winner randomly. So there, good luck.
Can I
So
take one of these?
no, no, you can't. We're so low on stocks. Ah! No, give it back. Don't even manhandle it. No, be
No.
kind. This. So okay, getting into our topic today. Regimens are one of those things. Like we did a popular live stream last year late on makeup, and I was a little hesitant having my mom on, but regimens are one of those things that can sound more marketing-y and more like
Marketing-y.
trendy or whatever.
Yes, marketing.
But it actually does. Regimens actually do have an important dermatological purpose. They have merit.
Yeah. Hashtag skin.
But 3 main things that sort of I can talk about there, and then my mom and I we can delve into more of the clinical aspect when my mom comes on. But first, a regimen means a certain level of mindfulness and purpose with regards to your skincare. You're not just sort of willy-nilly picking up products and trying them out. It's not fashion.
You
right?
have to have a certain, I guess, regimen. No.
There's a purpose. There's a
Yes.
reason, right? So
Yeah.
because it's actually not a good idea to kind of just keep experimenting without specificity. So like picking up a scrub here, then a cleanser there, then ooh, this moisturizer kind of looks
Yes.
cool. Then let me
Yes.
add this serum. It's not. It's a pretty reliable way to ask for problems.
Yeah, it is.
Especially for sensitive skin. Less is more is sort of the best adage in skincare, especially again for sensitive skin. And less is more means less products in total, but also your individual products. If you look at the ingredients list, the less ingredients that are there, the better, because there's less risk of cross reaction, less risk of reaction in general. So, more products of varying types and colors and manufacturers increases the risk of a reaction and makes it harder to identify what the cause is should a reaction occur.
Hey, you're going by the script.
Well, I'm just trying to remember important
can
talking
you,
points.
I want to read it.
Well, yeah, but I have to get through some important stuff
It's
tonight.
fine.
You can add on, though.
Alright.
So the second important thing about regimens to remember is efficacy and prevention. Dermatological procedures are great, like if you have fillers or if you have a laser treatment or whatever, they can be extremely dramatic. Like there's some people who have certain acne marks, for example, that might want to get a steroid injection. And it's quick, it's dramatic, but it's not going to help you in the long term, right?
I actually need to go. I miscounted. I have a call at 9:10, not
All right, well, we don't want your teacher
Sorry.
angry, so go.
I'm so sorry.
No problem, babe. Come back later. Okay.
Well, I'll
So
try.
if you want your acne or dark spots to go away and stay away, you can't just go in for a laser treatment every so often. It is a daily maintenance thing. If you want your psoriasis or eczema or rosacea or sensitive skin or acne or dark spots to really improve, it is a daily maintenance thing. This is related to the third medically legit reason to have a skincare regimen, and that is prevention and maintenance. So we all age. It's just what happens. Oxidation happens to all of us. We get dark spots, we get loss of elasticity, etc., etc. And then because of the world we live in now with a lot of chemicals, certainly in the pandemic, a lot of disinfection, we're seeing a lot more barrier defects. So there's a rise in skin reactions and sensitivity. There's a rise in drier skin, more sensitive skin, and a rise in contact dermatitis all around the world. So we do have to take care of our skins as we age, as we go through this life. The more our skin is exposed to different things, so that as we age better. And this is true of our bodies as well, right? So to improve the chances of our aging well, we got to work out, we got to eat right, anti-inflammatory practices, managing stress, getting 7 to 8 hours of sleep a night, plus a daily skincare regimen. The way I always talk about it, not having a daily skincare regimen is like not brushing your teeth every day and then just going to the dentist to get a tooth pulled when you need it. It's just not how it works. You have to brush your teeth every day. You have to take care of your skin every day. Or it's like eating a lot of junk food and not exercising and just really not taking care of your body and just relying on the cardiologist or the oncologist to do something much more severe when it all hits the fan. So a skincare regimen is a part of your healthcare regimen. It is a healthy habit. It is a good thing to have, and a legitimately good thing to have for your skin health. Basic elements of a regimen include preventive care, and I'll get into that later because everyone forgets about that. But otherwise, what you need is a cleanser or a scrub, never a bar soap. Bar soaps have a pH that is way too high and denaturing to skin, so we never suggest bar soaps especially for facial skin. So a cleanser or scrub, a toner or a moisturizer, ideally maybe with some actives to treat certain issues, a target treatment, and sun and light screen. That's kind of it. And in terms of choosing stuff, if you're really just starting out, any of our super skincare cleansers are a great idea. I don't know if you can see that. Yep, there you go. And these you would choose really basically according to skin type. Skin type is a great beginning, but it's not the be-all, end-all. You really have to look at what your skin symptoms are, what's causing them, and your goals. So, beyond that, you would then choose, for example, our regimen for super skincare is a great all-inclusive, basic, simple, multi-purpose regimen that has a cleanser, or a scrub. The toner, which is mandelic acid and monolaurin, so it deals with acne, certain level of brightening and rejuvenation. Then if your concern is really, let's say you shave, right? So you don't want to have a skincare regimen and then a shaving regimen. Our 1635 line for shaving is really a skincare line as well. So I use this particular cleanser actually. And it does have aftershaves that are really skincare. So it has a great aftershave for bumps. This one is one of them. And then it has an aftershave for extremely dry skin. So then you get most of your regimen in and you just top it off with maybe virgin coconut oil and a sunscreen. Other targeted regimens that we have would be Red Better for rosacea and redness and hypersensitive skin. Everything for rejuvenation. We have a nice video now up that really goes through this entire regimen. And then Illuminance is another really popular one for dark spots, right? And also ID. ID is for if the acne is more widespread, you need sort of deeper, more intensive care versus say super skin. And it is has a great combined regimen with Illuminance, and we talk about that on YouTube as well. Then in terms of target treatment, we showed off one that we're actually giving out today, the Re-Everything Eye Serum. Other ones are the Red Better Calm the Heck Down Balm for flare-ups. I really don't know if you guys can see that. I hope so. And the Spot Corrector for sort of larger cysts. I have a huge one on my nose. The amount of concealer I have on right now is not even funny. And something that we always like to say is really add the virgin coconut oil at the end of your regimen. If you're using an active, you want to go cleanser, then say the toner or the moisturizer and or the moisturizer with the active, then the virgin coconut oil, then the sun and light screen, which is important daily, indoors and outdoors, absolutely crucial. If you are not using something with an active ingredient, then your virgin coconut oil would come a little bit sooner in the regimen. Point is at the very end though, and with a sun and light screen, right? Armada 30, 45, 60, if your main concern is say melasma. Armada Baby or post-procedure are also excellent for very, very sensitive skin and dark spots, and for additional barrier care, and Armada Sport for when you're outdoors. But so we've really got a lot to go to choose from. Very quickly in the United States, you can get all of the stuff on our websites, vmphypoallergenics.com. Outside the Philippines, in the Philippines, it's .ph. In the US, we're now offering Route package protection at our website. So it's cool because you can track your package. You actually can even, there's a certain level of insurance built in, which is nice. In the Philippines, you get a free Superwash Mini and Re-Everything Eye Serum. And don't forget, if you would like a teleconsultation with my mom or any doctor we work with, drop us a private message and we can help make that happen. Also at our research center, we have our monolaurin pellets, and we even have nutritionist consultations. So one last thing I want to share before we call in my mom is, to me, one of the bigger tips to take home today, if nothing else, is stop thinking that a skincare regimen starts with your cleanser. A skincare regimen actually starts with your shampoo. A skincare regimen starts with prevention, period. I don't care how great your active ingredient is, how great your dermatological procedure is, the skin problem will always come back if you keep using things that cause the problem. So for us, it's, very simply Superwash and conditioner, or Clark Wash if you have very, very sensitive scalp. And say if you have acne or hyperpigmentation or dryness on the lips or around the mouth and chin, the Essence toothpaste is important, but it also applies, say, to makeup. For people with very sensitive skin, it might apply to things like laundry soap, the fabrics you use, goggles, etc. So a regimen isn't just the treatment and it isn't just the face. It has to include prevention, and it's the entire body. So on that note, finally, I will call in our research expert today, Dr. Vermen Varalyo Rawal, my mom and our founding dermatopathologist, who is coming slowly but surely, looking at me and nearing Slowly.
Right here.
Slowly.
Right here.
Okay.
Hi.
Hi.
Hi. Hi.
Hi. Hi. Mwah. Happy New Year.
Happy New Year. Happy New Year, everybody. Let me sit properly first, okay?
Okay. Oh, right. I forgot to put the pillow. I'm sorry about that.
There you go.
Out of practice.
Now I'm more comfortable.
Okay. So I started by saying how a skincare regimen sounds, I think, to some people as just sort of a marketing gimmicky kind of thing. But there is actually dermatological merit to having a proper skincare regimen. So I wanted to make sure that we had a resource who could tell us why, from the point of view of a mega clinician. Much of her research, so she has over 200 something published studies around the world. She's kind of a big deal. But she's so research oriented, and she deals with patients with very complex skin conditions, some of them hospitalized conditions, and yet she frequently talks about the importance of, you know, not just relying on a dermatological procedure, not just a drug. You have to approach everything holistically, from what you eat, how you sleep, etc., and a daily proper skincare regimen. So, say hi to everyone.
Hi.
So that's why she's here. Don't forget to get your questions in early so we can answer them. So, can we start with, from a clinical perspective, from someone who really sees the most serious stuff on the planet in terms of skin,
Okay.
is a skincare regimen legit?
Very, very legit. But it's not the old one, you know. The traditional kind of regimen that you were told about was you either have dry or oily or combination skin. You know, and so you were supposed to fall into either a dry skin person or an oily or a combination or something else. But basically, those were the three. Those kind of apply, but not really. Because in this day and age, there has been a lot of progress in dermatology, just like any of the other sciences. And now, how we doctors...
The dogs are...
Sorry about that.
That's okay.
How the dermatologists now are doing studies is that we are actually going into what, you know, we called it before personalized medicine, personalized dermatological. Then it's now called precision medicine because it's based upon the molecules and the genes that are being studied very thoroughly in our skin. And then there's the genomes besides the genes. The exposomes are now very important, which are hugely affecting the genes. So
it's really not
upstream,
just your genes.
Right.
Yeah.
So upstream, you have so many things to consider that affect the genes.
Yeah.
And that's both the internal environment that we create there, from sleep, from diet, you know, etc., and from the external environment, because unfortunately, our world is progressing so badly that it is ecologically terrible with the particulate matter and all of those kinds of things that are affecting our skin as well. So yes, I totally agree about a regimen, but it should be targeted to the person whose problem there is.
So it's not, what I was trying to say as sort of a, not a warning, but a best practice is, I think some people do think of skincare regimen as something fun that I can experiment with. Like, I'm going to try a blue top, and then, oh my gosh, I want another red top, and I want this earring and that. It's kind of not. A skincare, especially now, isn't fashion. It's not trying different colors on. It's really trying to identify what is it that your skin needs. Are you experiencing a barrier defect now? And for all the people who've been like, I've never had acne my whole life, why am I getting it as an adult? Because of this stuff. Life is changing. There's a lot of disinfectants wafting up now. We have maskne. There's a new term, I forget who it was, a huge, wonderful doctor in contact dermatitis also was talking. It's not just maskne, it's mass contact dermatitis or something like that. Your skin does change over time, just like your health changes over time. I was never allergic to penicillin my whole life. And then my second pregnancy, when they tested me before my C-section, boom, all of a sudden, I'm allergic to penicillin. I wasn't allergic to metals I was when I was a baby, allergic to metals. certain metals in earrings. And then when I got older, it was gone. And then it kind of came back, my nickel allergy. So things do change over time.
Very much
Right.
so.
And your regimen has to be targeted specifically to what your skin needs at that moment. Okay.
I'll give you an example, if I may. I recently saw somebody with acne, a 16-year-old, very active young lady. So 16, you'd think that traditionally we think that's adolescent acne. So that's due to the hormones that are evolving in her body so that she develops properly and becomes a young lady. Her periods begin and all of that. And that's traditionally called acne vulgaris. But I looked at her skin and it was gorgeous, almost as good as Laura's.
Woohoo!
From here down. Beautiful skin, small pores, no sign of inflammation or anything like a follicular kind of a problem. Her problem was in the forehead, right? And I look at it, just there.
See, this is the blessing of having a huge forehead. It makes for a great exhibition area. Go ahead.
And I thought, okay, tell me what you do. What is your day like? Well, about a couple of hours of exercise and running and things and basketball and whatever. The most important thing is that is therefore the reason why I say the regimen should not be regimented, Rona. You must be based upon what you see, what you have.
And the patterns.
And
You
the
mentioned it. The patterns are so important. If
Important.
you're noticing acne primarily on the cheeks, you do want to look at what are you doing over there?
Right.
Is it a mask? Is it where you sleep on the pillow?
Right.
I don't know. If you happen to wear other protective gear or even a scarf, we've seen that happen.
Or the telephone.
Or the telephone.
Or those things that come around.
Headphones.
Headphones.
Exactly. Or, is this where you're concentrating certain products that you're using? Really, it's like a roadmap, right? Where your lesions are existing in your body and on your face, that really helps to give you an indication of what is causing it.
Right.
So in addition to the stuff that you put on your face in the regimen, you really do have to look at the cause. Before we get to questions, because we have so many, I want to make sure we do go through what should a regimen have.
A regimen should have a cleanser, and then after that, either a toner.
Toner.
How do you say it?
Toner.
A toner, a moisturizer. I mean, the basic things that we're talking about, except only if you need it. If you're very oily skin already, why are you going to put a moisturizer?
Or a very occlusive moisturizer.
So you have to be very choosy about what you're going to use. You
Because
range from very
moisturizers are
light.
important, right?
Yes.
I mean, someone came out recently saying that you don't need a moisturizer anymore, especially if oily skin. This may or may not be true.
Yeah.
Oily skin can experience a barrier defect too, and therefore might need a moisturizer, but you don't need a very, very heavy, greasy one that's hyper occlusive that will then clog your pores. So you really have to know what it is your skin needs, and that's where a dermatologist can come in super handy, because then you're not just shopping for whatever cleanser, toner, moisturizer, whatever that you think you need. Your dermatologist will tell you, your skin is oily, but you're experiencing some barrier defect already or some sensitivity. So we do need to add a moisturizer to your regimen, but it needs to be non-comedogenic. It needs to have these ingredients, etc. Or you have very dry skin, but you have acne. You can't be reaching for
That's right.
hyper irritating, mega drying cleansers
Acids,
acids and treatments.
Right.
You have dry skin, so you have to get products that are sensitive to the dry skin, that will help keep water in, that will not irritate it further, but that will address bacteria or fungus or whatever the acne is. So it really has to be
Best example is
specific.
rosacea. Very dry skin, but boy, the acne can be, proliferating.
Yeah.
Okay.
So this is a favorite question that we get all the time. In what order do we apply each product? Cleanser, toner, moisturizer, like virgin coconut oil, sunscreen.
The lighter, the better. The more active treatment, the first. The very first ones that you would. First,
So
of
you
course,
go
the cleanser.
lighter to heavier.
Yes.
So cleanse is obviously first.
Yes.
Then toner, because it's usually just a liquid, right? It's water-based. Then your
The treatment.
cream. the treatment cream or moisturizer
Correct.
follows,
Yes.
right?
Yeah.
Then the virgin coconut oil.
That's right.
Because remember, virgin coconut oil has larger molecules,
Right.
and it forms a palisade on top of the skin.
Right.
If you put that first, the active ingredients won't penetrate as well because you've already created a palisade.
And then on top of that, for those who are really very dry skinned, I will apply a heavier, pure Vas alba, for instance, Vaseline. And, and there's still an
petroleum
and
jelly.
for people with brown
Not
skin.
Vaseline, petroleum jelly or
That's
Vas alba that's pure.
For people with brown skin or with, tinted skin, whether it's light brown to dark brown, darkest brown, I always suggest in this day and age in particular the use of a visible light protecting
Would be the last
sunscreen.
thing you put
That's
on.
the last thing you put on.
Right. The other day we were talking about it though, and you were saying virgin coconut oil goes before your moisturizer if you're not using actives, correct?
Right.
So if you're not using
Because
active
it's light.
ingredients, right, then it would be cleanser and then say virgin coconut oil, then your moisturizer.
That's right.
Then your petroleum jelly,
Right.
then your sunscreen.
That's
So it's really sort of lighter to heavier, and you basically want to think about what will you apply that will prevent the absorption of later things. So that's the basic logic of what goes in what order.
Right.
Okay, sorry. We have several questions. I want to make sure we get to them before we run out of time. So Helen, hi. Helen Blas, she's our friend at this point already, regular viewer. She experiments with many different products because it is fun. So she also reviews. So she reviews products, right? She's asking, what is your take on Kojic soaps? I tried one out of curiosity. It seems to work fine, but when I revert back to other facial washes, my skin breaks out. Whew, okay.
Kojic acid, I've worked with kojic acid actually.
She has some published studies on it, actually.
Yeah, I've
good ones.
I've worked with it, and it has its uses. You will know that there is no specific treatment for anything if there are so many medications out there available for it. And for pigmentation of the skin, you will notice there are so many acids, kojic and glycolic and retinoic and of course hydroquinone and kojic is just one of them.
It's a good one,
Yeah.
well studied
It's
and
very
effective.
good.
But
Yeah.
again, not in a vacuum. Also,
Right.
I think for me, what's more key here is the fact that you said Kojic soap. So a couple of things there. An active treatment in a wash-off product,
Yes.
you wash it off. So the efficacy really isn't going to be there because it doesn't stay on the skin long enough to do anything.
Right.
Plus, as I mentioned way early on, soaps are just not great for the face. Bar soaps, because of the way they're made, they're quite denaturing. The skin's natural acidity, the skin's natural pH is rather acidic. It's more acidic than neutral. Neutral 7. The skin is
And by the very
5.5,
nature of a
right?
bar of soap,
Yeah.
the pH is usually high.
Yeah, really high.
8, 9, 10
Exactly.
pH. That's pretty high out there.
So it's really drying
Far away from
and very denaturing.
from the natural pH of the skin, which is anywhere from 4.5 to 5.5 or 6.
So what's interesting to me then is if you use a soap on the face, right, that has an active, so it's already irritating because of the pH, it's got an active, I don't know what else is in there, if there's fragrance, I don't know what else. And then you go back to other products, now we don't know what the issue is.
That's right.
Has the skin been denatured because of the bar soap? And therefore anything that you use after that is going to trigger a reaction, be it acne, be it whatever. This is what we mean about be careful when you try so many different products. You are a professional reviewer, so one of the maybe good tips would be take a break when you're
Go on a
experimenting.
fast is what
Go
I
on
say.
a fast, right? A 7-day skin fast.
Yeah,
where
fast in between the products you're testing.
Exactly.
That'll be a great
Give your skin a chance to get back to a baseline, its baseline state. Just use pure virgin coconut oil, no fragrance, no nothing else to cleanse 7 days. And then try the next product.
That's right.
That might help. Okay, from Angel, would you recommend vitamin C and E serums?
Vitamin C and vitamin E serums, by the way it sounds, are usually bottled very well or packaged in such a way that it is not
Dark.
they're dark and
Like
they're
that.
not exposed to a lot of light, whether indoor or outdoor. So if you're using something like that,
Yeah. Okay. So here's, I think, part of the problem. Vitamin C is a wonderful
It
antioxidant,
is a fantastic antioxidant,
but it is such a temperamental, unstable antioxidant. It is so hard to extract, to process, even into supplements, which is why, there was a few years ago, several doctors signed a paper saying, can we please stop doing studies on nutritional supplements already because they're pointless. A lot of these things, when you extract them from their natural source, they just don't survive into a pill, cream, whatever. So the chances of you getting enough vitamin C that is still vitamin C, that is still potent, in a cream, not that high. Higher if, like she said, they're packaged in a dark bottle, small bottle with a dropper. There's a higher chance of getting vitamin C.
that's right.
But it's not guaranteed. They're very unstable. That's a very unstable antioxidant. Better to get your antioxidants, your vitamin C,
Take it from your food.
take it from your food.
So much better. And it's in the kind of chemical that the body understands, because it comes from one biological material to another biological human being, right? So
It's much better to eat it or drink it. That said, also, and so the same
fresher
thing
the
applies.
better.
The fresher, the better. Exactly. I was going to say, if you don't cook it, it's better. If you have it in a fresh salad, even juicing can be processing, so you lose some of it already, but it's still
Here's
better than in a cream, or or if you're cooking a broccoli or something, have it fresh if you can. Then, in terms of vitamin E, I think it's more stable, an antioxidant, also a very good moisturizer. But it is a top.
topically, it's a contact dermatitis. It's an
It's
allergen.
a top contact allergen. So that's kind of the concern there. But if you're not allergic to it,
Yeah.
go nuts.
It's in the top 80 allergens. So that it's included in the American Contact Dermatitis Society core allergen group.
Yeah.
So,
Okay.
be a little bit careful.
Be a little bit careful.
Topically. Internally, taken in
Internally,
food
yes.
is perfect.
Yes. Or eat it. Eat it. It's always better to eat it. Wait. Oh, so many questions. I'm sorry. Okay, here. From Jenny. When can we start? I start using a skincare regimen after having dermatitis for several months.
Wow, wonderful. So you got
Yeah.
rid of your dermatitis, but then you'll have to understand what it was. Was it a contact dermatitis? Was it part of an atopic process that went all the way from before, and you have a problem really with your filagrins and your barrier and all that? Or was it just a temporary dermatitis from something new that you had used and you had identified as being the cause and it's gone already? You have to recognize what the cause is. And then when you
Prevention.
start your regimen, my suggestion is really to start very easy and start with a cleanser, gentle,
Cream.
hypoallergenic, a cream cleanser, preferably no
no
scrub.
toner, no
Yeah.
toner, no scrub.
Right. And then a barrier repair, because, even if the dermatitis is already gone, there may still be a recuperating barrier of your skin. So you need to help that along by, my favorite is always
Virgin
putting
coconut
coconut oil, because it supplies its fatty acids to the skin and makes it, it can be used by the cells for repair of the lipid bilayer of the cells.
And then a physical sun and light screen
Right.
for both indoor and outdoor light. But also, if it's a physical one, it provides additional barrier protection.
That's right.
It's like a physical.
Yeah, an additional one.
On
The
top.
layering technique that I always
Yes,
talk
that
about.
She loves. Okay, from Annabelle. For skincare regimen, is it really required to have acids such as vitamin C or retinol if your concern is skin aging? Is it required? Nothing
In
is
the
required.
regimen, you mean topically as well?
It's helpful.
The acids have a lot of help,
Yeah,
because, like,
they're
for
really
instance,
good.
if you have clogged pores from,
She's talking about aging in particular.
yeah, so if you have clogged pores because of the aging process of
There's
your
a
skin,
helicopter. I hope you can hear us. I think you can still hear us.
what the
'cause we're
acids
like-
do, can you hear me now? What the acids do, okay, it's got louder.
They can hear us. We're good.
Bye-bye. Okay. So the acids, what they do is they get into that pore of the follicle, and it unseats it, so that therefore it opens up, and the oil that is produced by the sebaceous glands are able to flow out nicely, and you have a nice skin. The problem with acids, though, is that you have, again, to be very choosy about
Again,
it.
we're talking about aging, though. So she's
Yeah.
saying if I have a regimen and my concern is skin
Okay.
aging,
Yeah.
do I
No.
really need
With
acids?
skin aging, you do get acne. And at the same time, you can have the problem of changing skin, developing into, eventually, if you're not careful, developing into cancer. But the thing is that with aging skin as well, you have barrier defects, and so therefore, with the dryness of the skin that occurs because you're not producing as much oil anymore as you used to, you need to place a little bit of oil as well.
Yeah.
And then for the acids like the retin A and the other retinoic acid, rather, I'm sorry, with the retinoic acid and the other acids that are recommended for aging skin, you have to be very choosy that you use it sparingly at the very beginning. I just recently had a patient who I thought was not that sensitive. I gave her the lowest concentration of the retinoic acid, and guess what? Was irritated by it. So you must start out easy, like use it once a week, perhaps, depending upon the fact that what was causing your original problem, dermatitis, right?
No, she has no dermatitis. This is a different person.
This is a different person.
Okay, so okay, let me break this
Sorry,
down.
I got confused.
No, she just, this is why she's here. She's brilliant and goes everywhere. So, breaking that down, which is my job here. If we're talking about a regimen for skin aging, to me, one of the more important things to identify is what do you mean by skin aging? If we're just talking sort of duller skin, fine lines, one of the things that happens as we age is that the natural process of exfoliation, desquamation that we have in the skin, where we slough off old cells so that young, peppy, vibrant cells can come to the surface, this slows down significantly. So as we age, our skin is less elastic, it's less vibrant, it's a little duller. If we're talking about that, acids are phenomenal for that. I mean, really, the majority of, I would say, alpha hydroxy, beta hydroxy acids, all of that stuff, retinoic acid, they work by speeding up that desquamation, that renewal. So, yeah, if that's the concern, it's very helpful to have an active ingredient. If your concern with aging is dark spots, hyperpigmentation, an active can help with that as well. But so can just sunscreen daily, indoors and out. So can avoiding photoallergens every day. So it's not one thing. Sorry. So your question was, if I'm concerned about skin aging, do I really need acids and retinoic acid in my regimen? They're very advantageous with a lot of benefits. Can you get efficacy through other things like just virgin coconut oil and daily sun and light screen use and daily allergen and photoallergen avoidance? Yeah.
I was just
Also.
going to say, from the question, I can almost hear a person who really doesn't like to place too many things on the face.
Which is a good thing.
So the last part of her answer was perfect. You want something daily that you can use, a simple thing, use a sunscreen with visible light protection.
Exactly.
Every
Every day,
day.
both indoor and out, and prioritize prevention
That's
in
right.
everything else. Avoid allergens and photoallergens. Allergens, you'll be helping yourself because you're not subjecting your skin to stressors, which furthers the oxidation process, which is aging. Preventing by avoiding photoallergens, you prevent the dark spots. Avoiding comedogens, you avoid the acne, etc.
The nice thing about sunscreen is that it prevents as well as treats the aging process. All right?
Yeah.
So, there.
Okay, this is a fascinating one. I have so much to say, but we'll get her take first. From Anne, one of the more popular regimens is the, quote, 10-step regimen. More and more and more products. Is that much layering really needed and effective?
It depends.
Yeah, it really depends.
It
on your
really
skin.
depends. I do have some patients where you're layering something as, well, not quite 10. I mean, that's
I
illustrative.
use 10. I use 10 products.
But those depends upon what you need it for. There are so many problems nowadays that we have to address. When I talk with the patient, I really go from A to Z on the patient and what they're doing, where they're exposed to, what the lifestyle they have, and it's amazing when you get the story and eventually somebody will say, oh, by the way, that by the way is usually the crux, and you find out that there is something else that's really contributory to this thing.
okay. So I have stuff to say.
Yes.
So again, it really depends on what your skin condition is. Honestly, if you have psoriasis or eczema or rosacea, it would be a little surprising to see you with a 10-step regimen, because at this point you're looking at fewer products, you're looking at very hyper targeted care that is zero allergens, zero irritants, barrier repair, barrier repair, barrier repair, right? So you probably wouldn't get
And
to 10.
antimicrobial.
Right.
Because one of the things
Yeah.
about atopic people is
That's
that
right, Steph.
there are so many bugs there, even when it doesn't look infected.
Yeah.
And it's part of the reason why they itch so much.
Right.
Okay.
So, however, if you then have multiple skin concerns, so I grew up with really bad acne, and like a lot of people who have had acne as a kid, it stays with you as a nightmare, right? Like I have one cyst on my nose, one. It's really big, so I kind of look like Rudolph the Red-Nosed Reindeer. So again, when I say I have 14 layers of concealer, I really do. But this will wake me up at night because the terror of what I remember what acne used to look like will come back. So I haven't let go. I'm already 49. I don't get acne as much as I used to, but I can't believe that it'll never come back, right? So I still use acne products. My regimen is 10. I have a cleanser. I have toner 1 that is a beta hydroxy because it penetrates the beta hydroxy is the only active that is oil soluble. So it penetrates the skin, the pores oiliest, the inner walls, the skin's oiliest areas best, which also helps succeeding actives penetrate better. So I have a cleanser, I have a beta hydroxy toner, I have an alpha hydroxy monolaurin toner, I then have a cream 1 for rejuvenation, a cream 2 for pigmentation, I then have a monolaurin treatment for sweat acne, I then have my virgin coconut oil with retinoic acid, and I then have my sun and light screen. And then as I've gotten older, because of my rosacea and my skin has gotten drier because I'm older, what I have noticed is I need to take a break. Some days, especially when my seborrheic dermatitis flares up, when I have a flare, I need to stop everything and just use a very simple moisturizer and the virgin coconut oil and the sun and light screen. So it really depends what your skin
Is undergoing.
yeah, what it's going at that particular time, right? But sort of just to pick up 10 products because it sounds like it's better, absolutely not. You really have to figure out what you need.
Yeah.
This is a question to me from JC on Instagram, and I promised I would get it in. What to do for very big acne lesions?
For very big acne, don't pinch it. Don't prick it. Don't put your fingers on it. There are just so many bugs nowadays that are resistant. Last week or this week, what's today? Wednesday. Monday.
Another helicopter.
I had a patient.
Okay.
I had a patient whose culture showed mercy, not MRSA, but mercy.
Oh,
What is that?
interesting.
Methicillin-resistant Staphylococcus epidermidis. And what is epidermidis? Epidermidis is a natural or a normal microbiota of
Yeah.
the skin. And in this patient, grew a lot of epidermidis, and it was resistant already to clindamycin and erythromycin, and oxacillin. So we have to be really much more careful nowadays with all of these organisms being common in the skin.
Okay, very large cystic acne almost always has an internal component to deal with, meaning there's inflammation internally, probably lack of sleep. The diet might be involved if you're eating inflammatory foods, a lot of stress. Often for cystic acne, you might need prescription medication, correct? So for cystic acne, honestly, the first thing we always say is talk to a dermatologist.
Right.
Because you might need medication. You also might need certain lifestyle and dietary changes. And topical products can definitely help. Preventive products, certain treatments for sure. But cystic acne, you might need a medication. So
Right.
this is really something you have to talk to your doctor
Don't
about.
play around with cystic acne.
Yeah,
because,
exactly.
You know,
You also don't know what organisms are at play. That's what she was saying.
Right.
There's so many. You don't know if it's a very, very large acne lesion or if it's actually already MRSA or MRSA.
yeah. But many of the cystic acne is really just infected by, or rather populated by, organisms that are common in your skin, or rather native to your skin. You know,
They're
there's
just having a party. They're
That's
just too
right.
excited.
They're just stimulated, and so there's a lot of them there, and that's easily to
It
easy
could
to treat.
also be indicative of another concern, hormonal issues.
In women in
Right,
particular.
right. So again, I wouldn't mess around with cystic acne. I would immediately go talk to a dermatologist for sure.
And lastly, the important thing about it is that there is a drug that can be given for cystic acne, that when given properly and all that over a couple of months, you're 100% clear.
Yeah, it's
You look
miraculous. So it
gorgeous.
is worth talking to your dermatologist.
Go see your
For
dermatologist
this,
about it, though.
you know, you shell out a little bit more money for a consultation, but it's so much less money than the money spent on trying different topical products.
Correct.
And being disappointed. Or
See your
worsening the problem.
dermatologist.
Right. Okay, so another question from Cian. There are a few vitamin C products in the market that say stabilized vitamin C. Is it possible?
Yeah, there's ascorbyl acetate. They make it into a salt.
Yeah.
Yeah, but there have been studies on it that it does work, but it doesn't work as much as you think it does. In other words, take your vitamin C internally.
It's not compelling enough.
Drink it or eat it fresh
Yeah.
in salads and in juices and in shakes like this.
Exactly.
Much better.
Okay. Plus, another thing to note, stabilized vitamin C is not a regulated term. So you're not sure what that means, how
How they
stabilize it, right?
they
Unless
use-
you're so good in chemistry that you know
Yeah.
it is a salt. And you can identify
Did they in
that.
fact use radiation energy, for instance, some kind of electromagnetic? I mean, you know, what kind of stabilization was used?
Because there's nothing, you don't have to submit a paper showing that I stabilized it through this method and these were the results to an FDA in a country. It's just not a regulated term. From Hershey, what ingredient to avoid when you have acne, rosacea, and seborrheic dermatitis?
It's a lovely
Great
name.
question. I
Named
know.
after the chocolate.
Shh, I don't want to think about chocolate. Stop.
Okay, that was the question.
I'm still
I
detoxing.
I missed the
Okay.
question. I was focused on the name.
Back to the question. What ingredient to avoid when you have acne, rosacea, acne, and seborrheic dermatitis?
Okay, when you have seborrheic dermatitis and acne rosacea, you must avoid medications that are very strong, very irritating. Because to start with, this is a problem with what we call innate immunity. Rosacea is an immunological problem. And what it means is that in rosacea, they respond very quickly to irritants, to chemicals that are applied to them. So you have to be very,
Hyperreactive, yeah.
very gentle with the skin. Use light materials on it.
So,
Use the products that are available out there. In addition to the hyperirritability of the skin in rosacea, there are organisms which also tend to grow wildly there.
Demodex.
One is called a mite that looks gorgeous, by the way. When
He's
you
a
do
very cute mite. Honestly,
when
if
you
you see
do an
microscopic
examination,
pictures, they're
oh my God, there it is again, you know.
God.
So that can be treated as well. You can either drink it or apply it. But
The medicine for the mites is
Yeah.
what she's saying.
rosacea,
Yeah.
you don't play around with various
Also.
medications. As I said, go see a dermatologist, get the basic, and then follow it and all that, and stick to it.
Rosacea and seborrheic dermatitis are also frequently confused. So they're not something that I ever recommend that non-dermatologists try to self-diagnose. They can really be confused for several things. Even dermatologists can confuse them for several things. So it's really best to work with a dermatologist. But in terms of basic avoidance, you want to look at avoiding the top contact allergens. You want to look at avoiding irritants. We can certainly help you with that. Let us know. If a patch test would be miraculous because then you know exactly what you need to avoid. From Helen again, when you start with a new regimen, is purging normal? Some brands say it is, but others say that if the product is good, one shouldn't be breaking out.
It depends upon
Yeah.
the condition of your skin.
Yeah.
If your skin is flaring,
Yeah.
well, if it
Or
has
already
a lot of-
irritated.
right, I would purge before using
No.
any product.
Sorry, what she's asking is some brands say that if you start using them, there will be a purge. And some brands say no, if it's good, that should never happen. Okay. So a few things. For a comedone to develop, it kind of takes time
Oh yeah.
because you have to build up the clogging. So if you're using a bunch of products and they're already building up that clogging, and then you use a new product and break out, it may not be the new product. It might be product number 2
right.
or 6 or all of them building up the clogging? It's impossible to say. This is why it's so difficult when we're talking about using so many different products. And that's why that break in the middle is good, because you want the skin to get back to baseline. It is, there's no way. Also, if you're using a product with salicylic acid, a beta hydroxy acid, classic reaction is an initial purge, because it penetrates the inner walls of the pores. Mm-hmm. And not a lot of other actives do that. So if it's your first time using a beta hydroxy acid, it'll be exfoliating that deep-seated
It looks like it's
gunk.
getting worse before it gets
Exactly.
better. Just remember that.
Exactly. So, okay. Naomi, how young should we start with a skincare regimen?
From the start.
Okay, wait.
I mean it. Because babies are,
For babies,
the
it's really-
first 3
yeah.
months,
It's
maybe just
prevention.
from the mother or from the products that are being used on them. But I've seen infants, yay old, who've had, some kind of a rash or whatever.
Yeah.
So if the baby is completely normal, then fine. A very simple regimen and nothing very fancy is fine. Maybe that's the regimen you're talking about. It's very simple, simplistic kind.
I think you're touching on something important. If we change our perspective and we stop thinking of skincare regimen as just mega actives and something very sexy and sophisticated and complex and actives. Skincare regimens actually start when you're very young. Again, they start with prevention.
Right.
They start with gentle care.
Yeah.
They might start with moisturization, sun protection. All that stuff can be started quite
There are
young.
more and more studies now on infants, on babies, newborn, on how to care for them, right? And there's one that's
crap.
very, very nice, written by Dr. Kong of the USNIH about what they did was they examined the microbiota of babies who have parents who are expected to develop atopic dermatitis because they have a very strong family history of atopy. Okay, and what they did was they did the microbiota, and then they applied on one without any moisturizer on the skin, and another with a moisturizer, a simple moisturizer, as part of the daily skincare of the infant. And they found that after about, I'm really sorry, I don't remember the details as well, that maybe about a month or so, they did examine the microbiota again of these infants, and they found that the more normal looking microbiota that appeared were those babies that had a moisturizer than those without. It's a very interesting study.
There you go.
Yeah. And there are others on infants.
And
so
basic skincare regimen to teach our kids. I'll talk about that later if you can stick around, because she'll be leaving soon. I want to make sure we get to other questions. For creams and moisturizers, you really need to. I will get to that also later, because we kind of answered it earlier with a 10 product question from Christian. What would you recommend? Okay, I'll get to that as well, because I want to make sure we get the questions that we really need her. From Faye, which is better for acne, salicylic or azelaic? Great question.
Great question. I like both, by the way. I like a salicylic acid because of the reasons that Laura was talking about. The fact that it is an oily kind of an acid that goes down and deep and goes around the sebaceous glands and helps clear it up. I like azelaic acid, however, because in addition, especially for if you're treating people with brown skin, and we have inflammation as well as pigmentation, the azelaic acid is terrific for that. So it's got both anti-inflammatory and anti-pigmentation effects. So,
And some people find azelaic acid a bit too irritating, whereas some people don't like salicylic acid. So it really depends. In terms of better, it seems like efficacy is sort of on par.
right.
A lot of these things are on par. It just really depends on you, your skin, your particular history, your preferences, etc. So
Yeah,
depends on your doctor and you.
right.
Okay, wait, one more and then you can go, because I know you have stuff.
Yeah, I have another one.
Okay, Jean is asking what regimen to recommend for oily or acne-prone skin for a person who's already in the mid-30s. That I can kind of get into in detail, but I want her around for this question. Can I use virgin coconut oil as a moisturizer, considering I have very oily skin?
Sure. People think of virgin coconut oil as being a very greasy oil. It really isn't. It's a very light oil. You apply, just get a little bit, and then it spreads very nicely, and within another minute or two, you notice that your skin is nice and soft, but not oily. Nice and soft,
Yeah,
but
its
not
fatty
oily.
acids are
It's
native to skin, and it
right.
is not comedogenic.
And the fatty acids it makes are called medium chain, as opposed to the long chain ones that are common in olive oil and all the other kinds of long chain oils. But the coconut oil is medium chain. They're just very short little things that
Yeah.
delve directly into the skin.
The
So
studies that talk about virgin coconut oil as comedogenic are really old. They're based on rabbit ear tests from the 70s, and even then they were inconsistent. Newer tests, they're far newer technologies, methodologies rather, testing for comedogenicity and acnegenicity. And coconut oil fares very well. In addition, it has antimicrobial properties. So it actually is helpful. So yeah, you can use virgin coconut oil even with oily skin.
That's right.
On that note, I will let you go. I will continue to
Okay.
answer some other questions they have. I love you. Mwah. Thank
Love
you for
very
joining
much.
us.
You look terrific, by the way,
So do
today.
you. Thank you. Thanks, Mom.
Bye-bye.
Okay. So, to the other regimen questions, I will get to those now very quickly. Some of the ones I had to skip for her. What are the basic skincare regimens? This is for Noemi to teach our kids. Both my kids actually have YouTube videos on the regimens that they do. I have a 10-year-old who's there, who shares his regimen on YouTube, VMV Hypoallergenics' channel, and my 14-year-old also shares her regimen. And she's very active because she does dance 5 days a week, et cetera, et cetera. So she gets sweat acne and stuff. So she shares that. But, basically they both use Super Skin Care Scrub. They use Super Skin Toner. My daughter started with 1. She's now on 2. My son is using 1. My daughter uses the lightest moisturizer in Super Skincare. They use the Super Skincare Regimen, but my daughter adds Idmonolaurin gel. Okay, so Cian, should my skincare regimen be different for AM and PM? It can be. Some people prefer a heavier cream, like overnight to soak in and stuff. But frankly, me personally, I use the same morning and evening. My mom doesn't tend to differentiate with her patients. Do this in the morning, do this in the evening, unless it's a very particular overnight occlusion. For example, if you have eczema, atopic dermatitis, she might ask you to say when she says petroleum jelly, for us it's boo-boo balm, right? You would put boo-boo balm, let's say, and then you would either use cling wrap or a soft cotton wrap, and then you would leave that overnight for a deep, intensive occlusion therapy. Or if you don't tend to read at night with a lot of lights, maybe you don't need a sunscreen anymore. That's sort of the main difference. For creams and moisturizers, back to Anne, do I need 2? Again, it depends what you want to achieve. So I mentioned my regimen earlier is a cleanser. I use id toner, then super skin toner. I use everything cream, then illuminance cream, then a virgin coconut oil with retinoic acid, which is prepared at our clinic. So it's a percentage of retinoic acid just for me. Then on top of that, I use Idmonolaurin gel because I do get sweat acne still. I will use Red Better moisturizer if I feel like I'm flaring up. And then I use Armada post-procedure. It's a lot of products, but it really depends on what your skin needs. You don't need all that, then don't use all of that. If you don't need the 2 moisturizers, don't use it. For a 13-year-old who's now conscious of her pimple marks on her forehead, same thing. My daughter is 14. My daughter's regimen on YouTube is very helpful, and she can start Illuminance already at that age. We have a combined regimen of id and Illuminance that I just finished, and it's on YouTube as well. There. And a regimen for someone with oily or acne-prone skin in her 30s. I'm 49, so it's not so much an age thing. It really is what your skin needs. For acne, for eczema, for hyperpigmentation, for anything, it starts with prevention. And we do have regimens that are spelled out well on YouTube. From Anna, grateful for BB. Yay! Loved your videos on teen and tween routines. Yay! I have a newborn and I'm so excited to give her a routine. How early can I start teaching her the habit of taking care of her skin and eventually prevent acne? I started at 9. My sister started between 8 and 9. My daughter started at 9. My son at 10. So that's a very good age to start. What product? Super Skincare is a great idea. And for someone that young, I would choose the Super Skincare for dry skin. This is the one with the D because it's just gentler for everything. and then move up slowly, say to combination to oily as their adolescent acne develops. And then Grandma Mini products we currently use and love it. Yay, so do I. And I will do a session on moms and babies. Awesome. Thank you. Oh yeah, I had such a difficult postpartum thing too. Oh, I'm so happy that was helpful. Okay, I promise you, the one for moms and babies. I've been thinking about that. Thank you. Anna, can I add Re-Everything as a moisturizer because I want to prevent aging? My current routine in order is Red Better Cleanser, Illuminance Toner, and Moisturizer, Re-Everything Eye Serum, Gel Oil as well, and finally Sunscreen. Very similar regimen to mine. So the answer is yes, you can. But go very, very, very slowly. When I started combining my actives, it was once a week, twice a week. You can just go very slowly and prioritize prevention. And Jackie, can I use and include retinol serum with my Re-Everything regimen? The answer is theoretically yes, especially because Re-Everything has no allergens or photoallergens in it. However, we don't know what's in your retinol, what was it? Retinol serum. So there might be, we don't know. There might be allergens in it. There might be trace allergens. So it's difficult to predict what possible cross reactions might occur. But in terms of can you? Yeah, sure, theoretically. Just, again, start combining very, very slowly. Be observant, go slow. Okay, I won't go through everything again because we're already late. I don't want to keep you on so long. Remember to contact us with your patch test results so we can help customize recommendations for you based on your allergens. I'm waiting. Go ahead, say hello.
Hi, sorry, so sorry.
Don't forget, you can shop all our products at vmvhypoallergenics.ph in the Philippines.
PH in the Philippines and .com in the States.
Exactly.
And
Don't forget to
like, subscribe, click the notification bell if you're on YouTube. And if you're on Facebook, please follow us at VMV Hypoallergenics.
Yes. Okay. If you'd like a teleconsultation with my mom or other dermatologists we work with or nutritionists we work with,
just PMDM.
PMDM. And
I love that. PMDM.
Exactly. And congratulations to our winners today for our Re-Everything Eye Serum, which is a wonderful addition to any regimen. Faye Ang Angko and Annabelle Bautista Mago. Happy
Great
New
job,
Year.
guys. Happy New Year.
So that's it for us today. We'll see you next week. I think next week we're talking about the differences between food, skin allergies, like patch test, prick test. Fascinating topic. Really confusing, very cutting edge, sort of sophisticated, complex stuff. So we will see you then. Have a wonderful start to the year. Bye-bye.
No, I want to end it.
Okay, you go end it.